More harm than good? A new study finds growing evidence that COVID closures had little to no effect on saving lives and instead caused quite a bit of harmful social isolation.
This while children suffered the biggest challenge with school closings failing students and forever impacting their educational outcomes.
Here with more is Fox News medical contributor, Dr. Nicole Saphier. Dr. Saphier, great to see you this morning. Thanks for joining us. So a real shocker. It turns out lockdowns are bad for people.
Yeah, I mean, Charlie, I do sense a little bit of sarcasm there, but yeah, just add this to the growing list of studies. This is an epidemiological study out of the University of Virginia, and they essentially looked at excess deaths across the various states of our country from July 2020 through 2022. And what they could say is the states that had some of the more strict, mandates when it came to mask mandates, vaccine mandates, they did have fewer excess deaths, and compared to and they essentially just looked at those and saying, but hold on, by the way, I just want to point out there were a lot of confounding factors. I think there was a lot of bias within this study. But the one thing that they did conclude was that school closures, restaurant closures, and others really had no effect on the excess deaths and obviously did more harm than good. Here we are 4 years later. Recent surveys coming out from that 90% polling group showed that 1 in 3 students still have learning disabilities, developmental delays, behavioral issues, social issues, all from these lockdowns. So yes, obviously more harm than good, especially as it pertained to children when it came to COVID lockdowns.
And doctor, you know that the bluer the jurisdiction, the longer the lockdowns and closures lasted for the most part, especially, for example, in the home state of Kamala Harris, California. But it does strike me that if you look at the impact this is having, even on the midterm elections 2 years ago and then moving into 2024, people are just kind of blacking that out as like a horrible memory that a lot of folks just want to move on from. It doesn't seem to be moving the needle politically, even though the consequences, especially for kids, are very much still with us.
Well, people really want to put their head in the sand and pretend that this didn't actually happen, to pretend that the direct actions and the cause and effects from their political leaders cause substantial harm. Why are so many people leaving the blue states, going to the red states because of what happened during COVID? And one of the things that the authors didn't really mention in the study, they talked about quickly, they put it in parentheses, taking away people's, they called it freedom to make choices. And they said that this really upset people, but it really isn't a measurable thing. But that is one of the biggest issues that came from the pandemic. Look at all of the hesitation and the distrust now in our public health system when it comes to all vaccinations and all of public health. That's one of the biggest consequences of COVID-19, that people just no longer trust our public health establishments.
So, Dr. Saphier, there's another study out, and the headline from it is having a double mastectomy can significantly reduce the risk of getting breast cancer, but not surviving it. And this is a study that was done over 20 years, 660,000 female participants. So what can you tell us about this?
This is also a really important study in my day job. As you know, I work with breast cancer patients every single day, and that's what I do is I try to diagnose breast cancer as early as possible. And this is a very large study, and it adds to the data that we have already had that essentially shows if someone has breast cancer in one breast, whether they get a lumpectomy of that breast, a mastectomy of that breast, or a bilateral mastectomy, meaning removing both breasts, their chance of survival from that initial breast cancer doesn't actually change. Now, here's the caveat. We're talking about average risk women. We're not talking about women who have BRCA mutations, BRCA1, BRCA2, and many other mutations. They are higher risk. If a woman has breast cancer in one breast, there's about a 7% chance of getting breast cancer in the other breast. And now, while getting that breast cancer in the other breast does increase their risk of dying from breast cancer fourfold, it actually shows whether they remove the breast before that second cancer came or not doesn't really change their survival, because what happens is usually that woman will die from metastatic breast cancer from their first breast cancer. So at the end of the day, you talk to your surgeon, you talk to your oncologist, you do what you can to reduce your risk of breast cancer, and early detection saves lives.
Dr. Saphier, thank you so much for joining us. Have a great Sunday.
I'm Steve Ducey.
I'm Brian Kilmeade.
And I'm Ainsley Earhart. And click here to subscribe to the Fox News YouTube page to catch our hottest interviews and most compelling analysis.